I am with ECU Health Lifestyle Medicine Clinic and here with Diabetes Meets Lifestyle Medicine for the April check in. So, thank you so much for listening in. Just a little bit about myself with all the initials under the rainbow. As I get a little older, I get a little I'm not going to say wiser, but maybe so. Some days I'm wiser than others, but get a few more initials that are there. So I just want to go over. I am not an endocrinologist, but I've been working to help people with diabetes for many, many, many years. And it started out I was a registered nurse, and then I moved to Eastern North Carolina. I went to ECU for the BSN, Bachelor of Science in Nursing, and then a couple of years ago, I decided I'd go back and I became a DNP, Doctor of Nursing Practice. I am an adult gerontology nurse practitioner and I'm board certified, but I've also been a certified diabetes care and education specialist for more than 19 years. I have been living with diabetes for more than 35, almost 40 years, because I think it's 40 years now. And then I always just thought that I didn't have, people look so smart and wise when they had all these initials that I had no clue what they stood for, that I thought I would just add a few extra initials. So I added in CLIA because I am a Canadian living in America. And I'm also a OOFD. Sounds impressive. Yeah, not so. But it is an owner of 4 dogs. So I've got all this background. I've got my nursing background, my nurse practitioner background, and my diabetes educator background to help people with chronic conditions like diabetes, to help them understand and learn a little bit more each day so how that they could be the best manager of their own diabetes. And also way back when, before nursing school even, I became a chef. So I love to help people understand that healthy eating doesn't have to be expensive and it doesn't have to taste bad just because it's healthy. And I get to help people cook and bake on the low cost cheap. And I love to help people save money while they're trying to manage their health and wellness. Okay. Diabetes prevention and management at ECU Health Lifestyle Medicine, we have looked to coordinate and combine the ADCES, that's the Association of Diabetes Care and Education Specialists, their 7 hot self care topics with the lifestyle medicine, that's the American College of Lifestyle Medicine, 6 pillars of health. And those two bodies have loads of hot topics to help you be the best self manager of your health. And we have got things like lifestyle medicine, healthful eating, physical activity, managing stress, forming and developing and maintaining relationships, improving your sleep, and avoiding risky substances. And then on the other hand, with the diabetes management and self care behaviors, we've got healthy coping, healthy eating, being active, taking medications, monitoring, reducing risks, and problem solving. All of the things that help you be the best manager for your health, your wellness, your chronic conditions, and of course, diabetes being one of the big chronic conditions that I like to help people manage. So April is time for the showers, spring showers, and we got quite a bit of that on the weekend. So it's probably helping both flowers, vegetables, and weeds get growing in your garden. So hopefully the flowers and the vegetables will take over fairly soon, with a little help from the humans that have to go out there and get some physical activity with their weeding and cultivating. Okay. So keep that in mind. I know the last time I shared, or a few times before, because I'm a huge fan of growing some herbs, some flowers, because you need those for the bees, and vegetables and fruit locally. Imagine if you could go and pick tomatoes off your patio or off your front porch because you put a couple of pots. My colleague and I were talking that it doesn't have to be complicated. A bag of dirt, a couple of big 5-gallon buckets from anywhere, clean them out thoroughly, make sure that they are kind of the special, I think some of them will say food safe on them. And then get your bag of dirt, dump it in, put some holes in the bottom so you got drainage. Find a few seeds of things that you like, you and your family like. Could be pickling cucumbers, could be the big long ones, could be cherry tomatoes, but you could be making yourself towards a Greek salad on your front porch or your back garden with a couple of buckets filled. Okay. Just be thinking of that because maybe you might say you don't have a green thumb, but it turns out you've never tried to see if you have a green thumb. And Eastern North Carolina has great weather for growing a Mediterranean garden. So I always like to mention Spark People Calendar, and you can look this up on your smartphone and check it out. But for April, it is talking about green days. 30 days to greener lifestyle and thinking about the buzz around eco-friendly living, trying to recycle, reuse, reduce in our world. Of course, we can't do it all, but maybe just locally we think about, could we reuse that coffee tin for something? And even I've seen people put in their coffee tins, they put holes in the bottom. Guess what they put inside? Dirt. And again, guess what else they put in? Some little annual flowers, and then they can tie that up and put that hanging over your porch. So then you're helping to reduce, reuse, recycle. So I love that idea. If I can take something and use it more than a few times. My husband gets upset with me, but I can't help it. I will take stuff out of the trash and wash it and reuse it. For April 10th, which is today, happy April 10th. But think about your laundry. Does anybody remember, or do they still hang out their laundry outside using a rope? Tying it to two posts and getting some clothespins. And sometimes, well, you've got to have the clothespins if it's super windy and I've had things fly over into my neighbor. So got to go back and get it. Might be able to get by without washing it again, but when things fly off the laundry line, you might have to re-rinse. But there's nothing better than having the clothes drying out on the line, or your sheets hanging out on the line. And around here, when it's the summertime or the sun's shining, it takes seconds. So think about reducing your electricity bill with the dryer, or just think about taking a break. Because imagine in the summertime when we've got the dryer going, what does it produce? A lot of heat. And then when the heat's going, what's that going to do to our air? So that's something to just be thinking about going forward through April, May, June, July, August, September. Even I've hung stuff out because around here in the wintertime, we still have some warmer days. So you can do it. It can be done. I hope everyone was able to get out and do some walking on April 5th. That was National Walking Day, but every day should be National Walking Day, right? So think about it, get some shoes that fit, make sure they're comfortable, and get to step in because that could be a form of medication to help lower. What are some things walking could help lower? Think about it. I'm going to help you out. Could help lower your weight, help lower your blood pressure, help lower your blood sugar. What about your cholesterol? What about your risk for cancer, some cancers? Um, what about improving your mood? So, if you started walking and you got that as your new prescription starting today, what if you started walking every day if you haven't been walking in a while, what if you walked for 10 minutes every day? That could be your new medication to help chronic conditions you might have. And imagine if it did help, you might be on less what? Less regular soda, less Coca-Cola? Well, I hope you're already doing that anyway. But what about if you were on less medications? That would definitely help, right? You'll be less side effects. So think about that walking every day. Also, April 10th is known as National Siblings Day. So if you've got a brother, a sister, might be time to reach out to them and see how they're doing. If you are always in connection, give them a hug, give them saying you love them. That's always a great thing to keep in mind. People just need to know. Time goes by so fast, and sometimes we miss opportunities. So take the opportunity today to celebrate National Sibling Day. We talked about April Stress Awareness Month. And with that, thinking of using your senses like movement and your senses like your nose, aromatherapy, reading a good book could help with stress relief. With the aromatherapy, just some nice scents that make you feel good. I know when I smell an orange after it's been peeled, it's just like you can smell it right away and it perks you up because it's one of those scents that kind of invigorate, enliven you. So that's a good thing. Sitting outside and listening. And right now, with the gardens all a blooming, the birds are all a singing. There are many birds out there to be listening to. Sometimes it's quite, quite a noise and sound that could be helpful and peaceful for some. Pretty soon we'll start to hear the cicadas when it gets really hot and warm, but that's something to think about. Also thinking about singing and laughing, sharing some jokes. So you're moving your lips to kind of help. Just smiling, right? They say that it creates less muscles to smile versus frowning, so turning things upside down because we don't want to have more wrinkles on our face, right? Or we want them in the right spots, right? The other thing that April is known for is Alcohol Awareness Month. So this is something to think about. Where do you draw the line? You can take an anonymous alcohol use self-assessment, and that's howdoyouscore.org. So that will probably be asking you a few questions, and then it gives you an idea of where you score for, are you safe with alcohol? Are you doing the recommended requirements? Of course, you wouldn't need to take the quiz if you don't drink alcohol, which that's great. I hope you're drinking plenty of water. But if you do drink alcohol, make sure you understand what a size of a drink looks like. And so just as an FYI, a beer, that's 12 ounces. That's not those big bottles you can buy. That's not called one serving, but it's 12 ounces is a serving. When you drink liquor, it's not however big the glass is, it is a 1.5 ounces. So that's kind of like this. And for wine, it's 5 ounces. It doesn't matter if the goblet is this big, it's only 5 ounces as a serving. If you've got a wine glass this big, chances are you're drinking enough wine for the whole week, let alone following some guidelines. So think about that. No time like the present to make sure you are alcohol aware and doing as best you can do with that. Um, so just keep in mind ECU Health Lifestyle Medicine Clinic, we are here to help. We've got dietitians, we've got lifestyle coaches, we have lifestyle medicine clinic providers, we have people that help with weight, diabetes, your cholesterol, all those chronic things I mentioned earlier. We've got lifestyle coaches and exercise coaches. We have exercises medicine programs to help you get started, especially if you have been kind of slack on the physical activity and you might need a little jump start. That might be a thing that can help you start exercising safely. Because the worst that could happen is that you start to exercise and you jump in with both feet, your whole body, and you do too much and it creates an injury. So use caution, okay? We've also got coming up cooking demonstrations and cooking classes. And we'll be hearing more and more about that once we develop and roll out these classes. And we just want to make sure that people are aware of them. If you happen to be listening today, just check us out or give us a call. You can always call our front desk at 252-847-9908 to get more information and to get added to a list if to find out when there's going to be these classes started or make sure what we reach out so that you can get in on the waiting list. We want to make sure that people are taking good care of their diabetes, their high blood pressure, their cholesterol, and their weight, and that they use those lifestyle medicine components and pillars of health so that they can put a focus, on what they feel is most important that they need to work on. It's hard to create and conquer all of the pillars of health or all of the self care behaviors. Can't do it all at once, but maybe if you have diabetes, maybe you do need to start monitoring a bit more. Maybe you do need to find out if you're eligible for a continuous glucose monitor. Does it fit into your diabetes plan? Or are the medicines that you're taking, are they capturing what you need to have successful outcomes for your diabetes management? Now imagine if you lost a little bit of weight, 5% of what you weigh right today, you might need less medicine or a lower dose of the medicine, or possibly coming off a medicine. So knowing and monitoring your blood sugar is really important to find out how things are truly working. We also have a Sweet Talking with the Diabetes, a support group chat, and it meets monthly. Our next session will be April 19th, and we're going to talk about head to toe spring tune up and what you need to do and take care of to make sure you're on your best diabetes plan. Remember, you are the manager of your health, and being a self manager is self directed and finding out more information from reliable resources to make the best call for your changes day in, day out. There's no holiday to chronic conditions like diabetes, blood pressure, cholesterol, and your weight. There's just no day off. So you've got to work on a plan that fits in to your schedule, fits your budget, and make sure that you can do those things. Otherwise, it's not going to be that helpful. So our in-person Sweet Talking monthly diabetes support chat, it will be April 19th, 12 to 12:45. It's a little bit after 12, but I'm going to just say that so that you can get here because we're only a half hour. Reminder that disclaimer, lunch is not included. It's just an open chat for giving you some information while you're there. So if you or someone you know has diabetes or high blood pressure or high cholesterol and is interested in making some changes, feel free to reach out to our clinic to find out who's available to help and be on your team for wellness. Our number is 252-847-9908. If you know someone that's interested in the diabetes self management monthly reminders and resources, just leave your contact information with our front desk. Or, and I did not change it, you can send me an email, susan.houston@ecuhealth.org. .com will go to, I don't know, so that's just an idea of that. Make sure that you are staying hydrated. Oh, I had a little water bottle. I usually have my water glass, but make sure you are staying hydrated. And this is all the months of the year, all the seasons of the year. So every day we need a good chug a lug of water to make sure that we are getting well hydrated. Our skin will thank us, our kidneys will thank us, even our weight will thank us. So cheers to your good health. And a reminder, if you looked on, and of course, this one doesn't have a label. If you looked on a label and there was nutrition facts, it's going to say 0 calories, 0 carbs. If it doesn't say that, then there is something in that water that shouldn't be. Okay. So, cheers to your good health. And just be thinking of contacting us for diabetes prevention, diabetes care, diabetes management, our lifestyle medicine services. And if you wanted to know more about lifestyle medicine, what it's all about, please give us a call at the ECU Health Lifestyle Medicine Clinic at 252-847-9908. Thanks so much for joining. Bye now.